Hello. Welcome to Saturday night. We're not centered. You got to move over here.
I just like being close.
We got to look right. Okay. This is all the things. This is the show.
No.
What?
Okay, let's start again. We need to take
This
two.
is live. We can't do it live. All right, you ready?
Yes. Welcome to All the Things. I am Monique Duson.
And I am Krista Bontrager, also known as Theology Mom.
This is the show where we talk about all the things related to God, the Bible, and real life.
I just said let's have a clean opening.
Then you messed it up.
Well, you were looking down.
Don't nobody want to hear you right now. Stay on task. The Lord don't like ugly. Stop
All right.
it.
Helping us this week and every week back at the house is the one and only Bob Bontrager. If he's there. He's giving us the look.
And a fan.
He's done with us.
Sorry.
Okay, so we should give an update about our set. Like why are we still here miles away from Bob?
It's not miles away.
It's a few.
Like 2.
Oh, okay. All right.
Our set is still in the process of being made and
We're getting
redone.
very
We are
close.
So close. It's looking so good. I'm so excited.
We thought maybe we could have it tonight.
Yeah.
But we just didn't quite make it. So God willing, next week for our show with Katie Faust, we will have the set.
And thank you very much, Bob Bontrager, for painting, and
Emily Bontrager,
Abby Bontrager. It's a whole Bontrager situation. But thank you guys for painting and moving things and putting up with all of the shenanigans.
Yes, we're getting so close.
Yes.
We hope you like it.
Yeah.
So we are live.
We are live. But before I go too far in, my auntie Linda is on the stream, and I text her and my Uncle Jeff this morning, and ain't nobody got back to me. I was feeling all alone and hurt. I just saying,
You're just calling them out like that right here.
I love them.
Okay.
And so I need them to text me back, people.
You're a fine one to talk. People text me. They're like, I texted Monique days ago. Where is she?
You just ain't right.
All right, we are live. So we want to invite you to add your voice to tonight's conversation. This is the show where we actually read the comments on the stream. And if you have a good question, a relevant question, we always try to work those into the conversation.
Are you saying there are bad questions?
Well, sometimes they're a little off topic or random. But tonight's moderators are the one and only Alicia Moss and Elaine Voss.
Yes.
But it looks like Laura and Emily are there too.
Yes. It's a whole family thing.
Yes.
Karen is here from Alabama. Ooh, what part of Alabama? Close to Hoover? Because I love that area. And I also see Tiana's here.
Zoe says your hair looks great.
Thank you. Thank you very much. If it's not new, I haven't been around. Kind of new, new-ish.
Yeah.
It's on the spectrum of
new.
new.
You can go back to the family meeting from Thursday where we talked for 20 minutes about Monique's hair.
No, this is where she asked me questions for 20 minutes. Yes.
All right. Okay. We also want to encourage you to support the show. Make sure to click on that share button and like the show. Make sure you're still subscribed to the channel because occasionally YouTube likes to help you unsubscribe. So
I went on Facebook, on the Center for Biblical Unity Facebook, and on YouTube the other day, and was unsubscribed from both.
From your own channel.
Yes.
They're very helpful.
Yeah.
That's not actually helpful. All right. This show is brought to you by the Center for Biblical Unity, the Theology Mom podcast, and Family 210 Clothing. Let's see if Bob has a design for us tonight. There it is.
Truth Has No Color. That's one of my favorite shirts. Yes, because of the glasses and the afro, but also just the reality that where so many people are saying truth is relative to the experience of the color someone is.
Yeah.
We want to maintain a very biblical position and says that objective truth really does not belong to a color.
That's right. So about $10 of each shirt sale goes to help support the ministry, help support our family, depending on which design you pick. So thank you very much. It's a wonderful, practical way to help support the ministry. Okay.
Natalie asked a question, and I want to address this because I think it's really important. Natalie Roman on YouTube said, "Can a white person wear that shirt?" Yes. Yes. Truth knows no color. Like, truth is not 2 + 2 is going to be 4, whether it's a Hispanic person wearing it, a white person wearing it, a Black person wearing it. 2 and 2 is going to be objectively true. It's going to be 4. And yes, the whole conversation about math being racist and all that is a conversation, but we as Christians are going to stick to the biblical truth. And so I say, yes, wear it.
She says she's afraid she'll get clobbered.
I definitely hear the fear, and can understand that, and would just encourage you to consider it.
Yeah.
All right, let's keep going.
Okay. All right. So, we're still processing the big news from last Friday, about the Roe v. Wade decision on the Supreme Court. It's left, we're seeing tons of interaction on social media. You and I have been trying to strategize, like, okay, how can we help people, guide them through this conversation? So tonight is going to be the first in a series of discussions that we're going to be doing related to life issues, abortion issues, advocacy, practical things.
We'll talk about what's already being done.
Yeah.
One of the things that I heard with the decision of Roe v. Wade was, now it's time for Christians to get busy. No, we've been busy. Christians have been busy.
We've been doing that for a while now.
So what does it look like?
Yeah. So tonight we're just going to focus on medical questions. We have a very special guest to help us understand things from a medical perspective.
Yes.
And we're going to be tackling such questions as, what do you do when a mother's health is legitimately in danger? How do we think about that? How does somebody as a Christian working in the medical profession as a OB-GYN, leading us through that conversation ethically, biblically. We're going to talk about the rise of the use of chemical abortion. We're just going to unpack a lot of issues. So we are excited to bring on the show for the first time, Dr. Chris Cirucci. Welcome to the show, Chris.
Thank you so much for having me. I'm so excited to be here. I love your guys' show. You have such great information, but you guys have fun too. So
we try.
I love that. So thanks so much for having me.
This is the show where I bamboozled Monique into doing a podcast with me. So
that is true.
So Chris and I know each other, became acquainted with each other through my previous job at Reasons to Believe. She's a member of the Reasons to Believe scholar community. She's one of the scholars that I helped onboard and recruit when I was there. And super glad to have your expertise helping us out tonight. Maybe give people kind of a little 1-minute introduction into who you are and your background and that sort of thing.
Sorry.
There you go.
Thank you so much. Sorry, I thought I had unmuted. So first of all, I'm a Christian. I became a Christian when I was 13, surrendered my life to Jesus Christ. So that's first and foremost. But I am a board certified OB-GYN physician. I live in Pittsburgh, Pennsylvania, and where I've worked for 20 years in private practice. And I am vice chair of a very important organization, vice chair of the board, American Association of Pro-Life Obstetricians and Gynecologists. Believe it or not, there are some of us. And I am also a scholar with the Charlotte Lozier Institute, which is another pro-life organization. And then, as Krista mentioned, I'm involved with Reasons to Believe, which is where Krista and I met. So I've done some work overseas in third world countries, multiple trips to Bangladesh, and that's a heart of mine as well. But right now, God's brought me to do some work in the pro-life movement.
Very good. Did you ever think that you would live to see Roe overturned? I'm just curious.
Never in my wildest dreams. It's so exciting. I did in December when the oral arguments were being heard for the Dobbs case. We kind of thought maybe this could be possible.
And you said you went there, right?
I was there.
Yeah.
Yes, it was pretty incredible experience, but yes.
Yeah.
So, it's exciting what's going on.
I have to say that, I'm in my 50s, and so I've lived pretty much my whole life under the Roe v. Wade decision. I never thought I would ever live to see it overturned. And I have to tell you, in all honesty, I was shocked when my daughter texted me in that morning that it had been overturned. I was genuinely surprised. I did not think it was going to happen. So.
And then you came running into my room.
I did.
Boom.
I just said, you're not going to believe this.
Roe's overturned. Boom. I was like, okay. And good morning. Good morning. I'm still sleeping, but good morning. Yes.
So I think as a OB-GYN, I let's just start with talking a little bit about how you think through your ethical framework, the philosophical framework, but also, so your obligation as a doctor and that ethical obligation, but also thinking about your faith, and then how do you use those frameworks as you're advising patients?
Right. So lots of parts to that question, but let me just start with just some ethical basics of ethics that we're taught in medical school. And so there's several basic principles. One of those is beneficence, which means doing good for the patient. And, as an obstetrician, I have two patients. I have the mother and I have the baby. So the first thing is beneficence, doing the right thing, doing good for the patient. The second thing is malfeasance, meaning not doing wrong. We often say, do no harm. And then the third principle is autonomy. So the patient, I can advise the patient and inform her, and she may choose not to go along that road, and that's fine. People have their own autonomy. So I may a patient with cancer, I may recommend a treatment, and they may say no, and that's fine. That's her autonomy. And then also justice, which is treating people with equality. So those are some guiding principles, but when you look at those in every aspect of medicine, they really apply. And like I said, an important thing is I have two patients, and so I have to do that for both of my patients, the mother and the baby.
I want to ask a follow-up to that. Yeah. So as a Christian, then does that interface at all in your conversations with people, or do you kind of go into that room, thinking about it through sort of the medical ethic lens? Maybe you could talk a little bit about how your faith interacts with that or doesn't.
Sure. So, I agree with those principles. I think those principles are consistent with my faith. My faith guides all that I do. So I do have certain, the field of OB-GYN is just laden with ethical issues. So obviously that my faith guides how I treat those things, including abortion. So now we are told, we're always taught, don't be biased with your patients. Well, the thing is, we're all biased. And so my responsibility is to provide information, to advise the patient, to tell her the truth. But in the end, she makes a decision. I don't know if that's answering your question.
Yeah, I think so. And it just helps us understand kind of what the guiding principles are that help frame up your conversations.
One of the things that I am seeing a lot is the fact that in the church or in the culture, people don't agree on when life actually begins. And what I'm hearing you say is that you have two patients, the mother and the baby. At what point does the baby become the baby? At what point does life begin?
From your perspective.
Yeah, from your perspective.
Because we have a real biologist here.
Yes.
So you might know what a woman is.
You might know what a baby is.
I love it. Yes, I do know what a woman and a baby are. So life begins at conception. I believe that not just because of my faith, but biology shows us that. You know, when a sperm and egg meet and the DNA combine, that one cell organism has the unique genetic makeup. Its DNA is different than any other human being. Its sex, its eye color, those things are already determined at the moment of conception. And I think that people used to say it wasn't clear. I think now that science, as we've learned more, scientists are realizing, yes, life begins at conception, but well, is it really a person? Well, I would believe it's a person at conception as well.
I think I really want to highlight an important point because I don't want it to pass people by, that when the sperm fertilizes the egg and that zygote is formed, that life has its own DNA. Mm-hmm. It has its own unique code, and it is different than the mother's DNA. And that is what makes it life, as opposed to saying sperm is life or the egg is life. Maybe you could talk a little bit more about that.
Yes, absolutely. You said it well. It's its own unique DNA. It's got 23 pairs of its own chromosomes that come from its mother and father, where a sperm is a cell from the father. It's not a unique human being. You know, I have skin cells, I have hair cells. It's a cell. I mean, it's different than those, but it's not a unique human being. But yet when the egg and the sperm meet at conception, that being has its own set of genetic makeup.
We should probably clarify, like, really quick. This is a point that we haven't said, is that Monique used to be pro-choice.
You didn't ask me if we could tell them that.
We've talked about it before. It's not a secret. So this is an issue that you've had to.
It's an issue that I'm still working through. Like, if I'm 100% honest, like, I think abortion is murder. I do. But you haven't always held that position. I haven't always held that position. And sometimes it's difficult to talk about publicly. Y'all, I am still human, just like everybody else. Somebody's like, I don't want to wear that shirt. Well, I don't want to have this conversation. It's a human thing. And we exercise courage and we work through those things. Sometimes it's a long time. Sometimes it's not. But here I am. And so for me, part of the conversation of viability has always been like on the table of like, well, if it's not really viable for life, is it really life? Is it really life? And it makes it okay to abort because it's not really viable. What would you, it's just me and you here. And Krista listening in. What would you say to the argument of viability? Like, is it just, well, I think I'm at the place of, if you just leave it alone, it would continue to grow and be a human. But I don't know if it's that black and white. Right. You state that well. I think that is many people's view. So let me put it this way. So, at 40 weeks, a woman is full term. And at, say, 22 weeks, it used to be 24, 25. Now we have babies at 22 weeks that can live outside the womb with a lot of help. So if that baby is a person when it's born at 22 weeks, is it not a person at 21 weeks, 23 hours? And you can carry that argument back. There's no event that happens in the uterus that suddenly transforms this being to a person. And you could say, well, they're dependent. Well, so is the 3-month-old or the 2-year-old or the 90-year-old. So I believe that's how I see it. There is no transition that you can say, this is, now it's a
not a life, or now it's a person, not a person. It starts at conception.
Yeah.
Yeah, thank you. I think that's the place that I have arrived at, but it's definitely good for us to be able to hear, because we can take that wording or that argument to our friends who may be pro-choice or pro-abortion.
Yeah. And I think that for me, what was persuasive was understanding genetically the baby is a separate entity from the beginning.
Yeah.
It has its own DNA. And so I think that for me, that's an important part of the conversation. We don't even need to talk about it biblically. We're just talking about it biologically and how are we defining life? And I think that the question of personhood, it would probably be great to get our friend Joe Miller to come on and talk about the differences between being a human and being a person and how that's being parsed out in the culture right now. But I think that that's a distinction that people might run into where they want to divide, what's life and what's a human versus what's a person, what's the soulish component and all of that. But this question of viability, that timeline keeps getting pushed back as medical technology advances. And I think that what's important to understand is that Chris is bringing out is that there's no magical thing that, like, let's say we used to have viability at 25 weeks. Now we've pushed it back to 22 weeks. Well, there was nothing magical that happened in between those two times that made it the baby a person. It was the medical technology that advanced that allowed it to have longevity outside of the womb. So these are some of the tricky things that we've got to help people, think through. I think another thing that's very common, Chris, that we hear out on social media and the culture is that abortion needs to be legal to save the life of the mother. Now, I know that statistically, this is actually a very small percentage of the abortions that are performed for the sake of the life of the mother. The vast majority are on demand and for other reasons. But maybe you can walk us through, how you think about your ethical obligations about saving the life of the baby versus trying to save the life of the mother, and how does that show up in your patient room?
Right. So you are correct. It is much more uncommon than is often put out there. I have never had a situation where an abortion had to be done to save the life of the mother. So I have two patients. I have the mother and the baby, and there can be severe medical conditions in the mother that require earlier delivery and other things. And sometimes you have to deliver the baby early and the baby might not make it because it's early. That is different than, oh, well, you have this condition, so we're going to kill your baby and so you're not pregnant. We can always induce labor or a C-section, or we can always separate the mother and the baby. But that's not an abortion.
So you've never had an instance where you have had to say, or where a patient has had to consider possibly having an abortion versus taking her baby to at least birth, even if it wasn't full term?
I'm trying to understand what you're saying. Where the choice is, the mother's sick, so get an abortion, or the other. So let's say, maybe it's better to just use an example. One example that could be used if a woman's, very early, like 19 weeks, 20 weeks, so the baby can't live outside the womb, her water breaks. And what happens, sometimes that fills up and rarely, but what happens with time is sometimes that woman gets infected and she's getting infected. She's going to get sick very fast. The baby's not going to make it either way. And sometimes you have to induce labor to save the mother. we're not killing the baby. The baby unfortunately will not make it, but that is not an abortion. So sometimes we have to separate the mother and the baby. That doesn't mean we're killing the baby. We're not dismembering the child. We're treating the child with respect.
Wow.
We're letting the mother hold the baby. I mean, this is a whole different scenario. And again, you're always trying to save both lives. But sometimes it's not possible. And you do everything you can do to maximize that.
I think that language is very helpful, that you do everything you can to save life. And sometimes you have to separate the mother and baby, but there's still dignity, value, and worth in the baby. It's not you're
not chopping it up or actively. There's a difference between active killing, which is what an abortion does, versus what you're talking about is separating the mother and the baby, so that there can be dignity in the situation. The mother gets to hold the baby and see the baby and all of that. Would that be kind of the differentiation between the two?
Absolutely. And then there are, that is a very good explanation. And there are other situations, thinking of a situation where at 24 weeks, the woman had severe preeclampsia. I mean, if we don't get this baby delivered, she's going to have seizures and get very sick. Well, we did some things to maximize that, gave steroids, and the baby was delivered. And the baby was delivered at 24 weeks instead of 40 weeks. And the baby spent several months in the NICU. Now, some of those babies don't do well, but I can tell you this baby now is a beautiful 14-year-old girl.
Wow.
And so there are situations where we have to act and deliver early, but you're always trying to maximize both patients.
I was
just going to say, as a person who suffered through preeclampsia twice, I am very grateful for everything that my OBs did to help treat both my children and myself. And it was hard, especially with our first daughter. I had it much worse at the front end, and it started in the first trimester. And so I had a very long pregnancy, and they were like, we want to keep that baby in there as long as we possibly can. And we were able to do that until 37 weeks. And so I was able to bring the baby to term, but there was a long, hard road. But yes, I'm getting more of the picture now of what you're saying here of how you're walking that journey with both patients in mind. It gives me a deeper appreciation for what my doctors were trying to do. So
one of the things that I think I see a lot of, and I've definitely seen a lot of the last week, is this argument that medically induced abortions are needed, and that are to save the life of the mother. So that there are generally many things that happen in pregnancy. I've never been pregnant, but just looking at Twitter or social media, which isn't the best reliable source for, my information, but it seems like there's a ton of issues that pregnant women go through where, we should definitely be considering abortions a lot. Is that the case? Like, are there tons and tons of pregnant women that are experiencing all of these like medical issues? Someone actually in the chat, which is why I'm thinking about it, is because someone in the chat said it's like less than 1%. And I think AJ Rich is an RN. And somewhere up in the chat, I think they said like it's less than 1%, but I don't know. It made me think about that, because I see it as like maybe 40%.
You mean the way it's talked about?
The way it's talked about
on social media, it just seems like you have all these women who might die.
Yes.
Because if they can't have an abortion.
Yeah, because of a medical issue, that it's like, well, if I need to save my life so that I can raise my other 3 kids, or, have this baby that we don't know and die, then what? But I'm just wondering, like, what is it, a huge percentage? Like, is this something that doctors around the country are seeing a lot of, or is it, I would have to go back and find it. Is it a very small percentage? Like, I think the commenter said 1%.
It's extremely, extremely, extremely rare. And as I said, there are other ways to manage those situations without an abortion.
Yeah.
Abortion might be easier for the doctor, just whatever, but it's never the right thing for the baby.
Because I think in your case, you would say that it does harm to one of your patients. And if one of your guiding principles is do no harm, you're thinking not just about the mother, but also how do I treat the baby as well? Is that kind of how you think about that?
Right. But I'm also, I'm treating the mother also. Like if she needs to not be pregnant, like say she has severe cardiomyopathy or, preeclampsia or HELP syndrome, or there's so many, when obstetrics goes bad, it goes bad quickly and very severely. Mm-hmm. So there are those situations. They're not, rare necessarily, but there's a way that you treat that. And again, sometimes we have to separate the baby and the mother. Yeah. And unless you're really early, we have the technology and, babies can often do well. They don't always, but of abortion, I've delivered thousands of babies and taken care of many times more that pregnant women. And I've never seen that situation where that was abortion was necessary for the mother's life.
Yeah. So now let's look at the side, just one more question on the side of the mother. And then I want to field some questions that are coming in on the chat on the side of the baby. So let's say the mother has a medical condition like cancer, mm-hmm. Cervical cancer. I think that could be rare, but have you ever been in a situation where the mother has, that kind of condition and you would have to terminate the pregnancy? You would have to actively abort the child in order to provide a chance of the mother's survival.
So cancer in pregnancy can be very complex, and I certainly have seen that. And with cancer in pregnancy, when a woman is pregnant and then diagnosed with cancer, we work with a team. We get everybody on board. We would get the GYN oncologist, the cancer doctor, the perinatologist who is the high risk obstetrician. We would get the neonatologist who is the pediatrician that takes care of tiny, tiny little babies, and develop a plan. And sometimes that's delivering early. For cervical cancer, it might be a C-section. Sometimes it's deferring the cancer treatment until delivery. Again, I've never seen a situation where, you may do things differently, but I've never seen a situation you actually have to do an abortion in that situation.
All right. So let's talk about the child. On the child side, would it be, somebody's asking in the chat, would it be considered an abortion if the baby dies in utero? Is that an abortion?
No. And there's a lot of, since Roe v. Wade, there's been some rhetoric out there like ectopic's an abortion, a miscarriage is abortion. No. An abortion is an active killing of the baby to kill the baby. That's not a technical definition. That's just I'm defining it now. But if a woman loses a baby and the baby dies, a stillbirth or a miscarriage, that's not an abortion. That's this very sad event, but it's a death. It's not a killing. Is that, if I'm understanding the question correctly?
Yeah. And I think like even, let's talk about the ectopic pregnancy a little bit more. Maybe first explain what an ectopic pregnancy is from a medical perspective, and then how that's handled and what kind of language a way of talking about that.
Yes. So an ectopic pregnancy is a pregnancy that's not in the uterus. Most of the time it's in the fallopian tube. And unfortunately, a baby that's not in the uterus, a baby that's in the tube can never live. That isn't possible. That isn't the environment for a baby to grow. And if I don't treat that ectopic pregnancy, the tube will rupture and the mother will have severe internal bleeding. Women have died of ectopic pregnancy. It's a medical, emergency. So again, yes, if a woman has an ectopic pregnancy, I would treat the pregnancy, treat that. It's either medically or surgically, but that's not an abortion. So there's rhetoric out there that, oh, now we can't treat ectopic pregnancies. I said I work with American Association of Pro-Life OB-GYNs, and we just put a statement on our website about that. And treating ectopics is not an abortion. Unfortunately, we can't save the baby. There's no technology to do that, but we have to separate the mother and the baby and, save the mother's life.
I think this is really helpful to help us understand some of the language that you use in thinking about it as a doctor, because there's so much crazy rhetoric on social media right now. And this is very helpful. I want to ask you too about heartbeat bills, because one of the objections I've seen on social media is now that OBs cannot treat patients with ectopic pregnancies because of heartbeat laws, and that they will be subject to medical malpractice.
Why don't you give us some wording around a heartbeat bill or heartbeat law, so we're all on the same page?
Yeah, so some states, in anticipation of Roe being overturned, are passing what's called heartbeat laws, where you cannot perform an abortion once there is a heartbeat that's present. And Chris would know better than I as to, what week the heartbeat tends to appear. But there's a lot of rhetoric that now OBs will be forbidden from treating patients with ectopic pregnancies because of these heartbeat laws. So I'm wondering if you can maybe weigh in on that a little bit.
Yeah, that is not true either. I mean, I don't know all the details. I'm not a lawyer, obviously, but that's not what that law is not what it's meant to do. And sometimes an ectopic pregnancy will have a heartbeat. Usually they don't because they're earlier. But there is no situation that the same thing with a miscarriage. That's not an abortion. It's not an abortion. Now, will there be, is there fear and trembling out there, and what's people going to get in trouble for? And am I going to be accused of this? That may be true, but treating an ectopic pregnancy, treating a miscarriage is not an abortion. I cannot save that baby. There's nothing I can do. And if I don't do anything, the mother will die. We're about life, and treating ectopics not an abortion. So my understanding of the law, again, I don't know the details legally because that's not my area, but that's not what the intention there is.
I was just going to ask a different question.
For sure, yeah.
So now looking at like a child with birth defects, I have done some reading on Margaret Sanger and her thoughts of, whether or not children with birth defects, the poor, whatever, should actually be given the right to live. What are the ethical obligations of an OB to counsel parents when their child may have a birth defect? Or if the child is like very high risk at dying shortly after birth?
Yeah, Monique, that's a great question. So I think it goes back to those ethical principles. Some doctors would say, oh, your baby has this defect, let's do an abortion, or I don't find that to be appropriate. But what is my obligation is to inform the mother, to tell her the truth. When I have a mother who we detect a birth defect in utero while she's pregnant, I will refer her to a high-risk OB doctor, a maternal fetal medicine specialist. They will be able to give her more information, and some of those things can be treated after birth, rarely during, in utero, and get more information. Sometimes we think there's something going on and then there isn't a birth defect. So the first thing is to inform the patient and give her the information. But again, she has autonomy. And so if she chooses to abort that baby, that's her choice. That's her option. Now, you mentioned about after the baby is born. There's something that has become more frequent of late called perinatal hospice, or it has another name. But so if we have a baby with, say, trisomy 13 or 18, or a baby that we know is not going to live more than a few hours or days after birth, some people would recommend an abortion. Well, the alternative is perinatal hospice. So you let that baby be born, you provide an environment for the mother and the father to spend time with their baby, comfort care, grieving. And that can be a really, really special time that people will treasure with their baby. And it gives dignity to that baby and to the parents. It's heartbreaking when a child has something like that, but there are better ways to deal with it than killing it.
I'm so glad you brought that up, because I think that's an issue that a lot of people don't understand. They're not really aware of, as hospice is available for those babies that have those kinds of severe birth defects where they're just not going to survive. But I think that it's also important for Christians to understand to not tell their friends who are journeying through that season, you're doing an abortion. Like, that's not helpful either. Yeah. To say that, oh, you ended your ectopic pregnancy, or you had this baby with trisomy 13, you had an abortion. Because I had a friend who went through that. It was very damaging to her, that so many Christians were telling her that having her baby with trisomy 13, and for the few hours that she and her husband got to spend with the baby, that was an abortion. Like, we don't want to be doing that either. Maybe you can comment on that a little bit.
Well, right. That's a good example. These are mothers in these situations, and fathers are grieving. I mean, this is losing a child. A miscarriage is losing a child. We don't want to add grief upon grief. I've heard what you're saying, like, oh, well, why did you even let your baby be born? I mean, I haven't literally heard that, but I've heard people saying that. And that's just, again, that's a precious child. And we don't want to add grief upon grief and accuse a mother of something that isn't true, for sure.
Wow. So when a situation comes up where, because I remember for me, when I was pregnant, I had to take a blood test. I think it was when I was about 5 months pregnant. It was some big blood test to do a screening for potential birth defects. And I actually think that with my first child, I didn't even do the blood test. I was like, because either way, I'm not going to abort the child. And so that was medically what I chose. I chose to not do that. But for some people that get those results back and there is a birth defect, walk us through a little bit about how you counsel those parents. I mean, you said earlier, you might refer them to another doctor, a specialist, but it on social media, it makes it sound like the minute that there's a conversation about a birth defect, abortion is supposed to be the immediate remedy for that. Yeah. I mean, even for a Down syndrome baby. And I'm just wondering if you can help us think that through a little bit more.
Well, a couple things. Those tests, the prenatal, testing for birth defects, some of them are screening tests, so they're not definitive. And so sometimes when a test comes back abnormal, and these tests have kind of gone through a lot of advancements, if you want to call it that, over the recent years. And so if they come back abnormal, sometimes that just means your risk is higher and you need further evaluation. But let's say it's concluded that your baby has a problem. again, how are we valuing people? Are we saying that a baby in the womb isn't a person? Are we saying a handicapped person isn't a person? Are we saying a 90-year-old isn't a person? I mean, these are human beings. These are people in the image of God. And again, my patient has autonomy. I can't tell my patient what to do. I will give her the information about the situation and yes, refer her to the appropriate people. But those, again, you have to really look. A lot of it is getting the right information so you know that you're dealing with. I know people who've been told to abort their babies and they don't, and then their baby's normal. Well, let's make sure we have our facts straight, first of all. And, that's kind of how I look at it.
Yeah.
There's a comment on YouTube from CS, and they're saying the exact same thing that you're saying. It says, my sister-in-law was told that my nephew had Down syndrome before birth. He did not. They recommended abortion. Thank God she would not.
I have Bob and I have a friend from our previous church. Similar thing. There was a genetic screening. The doctors recommended abortion because they were told the child had this birth defect. We prayed for the baby. My husband and I prayed for the baby. And the baby, in this case, when she was born, was perfectly healthy. They went through the genetic screening over again, and there was no evidence of that. And that little girl's 6 years old now and running around and bothering her big brother and sister. And, it's so people are making really big decisions, and sometimes, things are wrong. And, but that brings me to the importance of the Christian thinking through their worldview ahead of time, like the time to get clear about your worldview and your stand for life is really hard to do when you're in the middle of a crisis and your doctor is giving you some super bad news about, potentially a birth defect in your child and recommending a termination. I think that, the time to get clear about your worldview is ideally before that, to know, what you and your husband are going to be up for, and how, I remember my husband and I having that conversation of, we're not going to get this screening test because for us, that wouldn't impact our decision. And so we just decided not to do that, but we weren't trying to think through this big ethical issue right in the moment. We kind of had a stand ahead of time. And this is so important because we want to encourage pastors to be having these conversations in their pulpits and helping in discipleship on these issues, so that people aren't just left to only talk to their doctor or think that their doctor is the only person who can weigh in on this, because not every doctor is going to, have a Christian worldview the way that you do, Chris. I don't know, maybe you can comment on that.
I think you make a great point. It's that way with a lot of things in life, that when you're in the heat of the moment or the tragedy is the harder time to develop your personal, worldview principles. So I think you're right. And, we have to get founded in those things ahead of time and as much as we can.
Yeah.
This is why discipleship is important.
Yeah. And this is why we have these conversations here in public. And,
But I mean, even like in youth group, like how are you, guiding your students to think about life?
Yeah.
If you're now, 30 years old and about to have a baby, and, now you're faced with a tough decision, like you're saying, like, that's not the time to have to consider your worldview. Yeah. We should be raising our kids to understand, life and what it means to be a human person.
If we can maybe just do a couple of sort of change gears here a little bit and talk about birth control a little bit, because this is something that I've also seen on social media that there's a lot of confusion about. Birth control, hormonal-based birth control is something that, kind of came around, I think, in the 50s or 60s. But I think that there's still not a lot of wide understanding of how this magical pill works. And I don't think that many doctors inform their patients exactly how it's working. It's just kind of like, if you get on this magical hormonal pill, then it will prevent pregnancy, but we don't have always a knowledge of how that works.
Mm-hmm.
So is that something maybe you can walk through for us, and how that works and how that connects to the conversation about abortion?
Sure. Well, you mentioned hormonal contraception, and I think you're thinking of the birth control pill, but there are actually several different kinds of hormonal contraception. So there's the birth control pill that we think about that has estrogen and progesterone. There's another birth control pill called the progesterone only pill, and it works differently. There's an IUD that releases progesterone. There's a progesterone shot. So there are several different, at least, types of hormonal contraception, and you really have to look at how they work, their mechanism. So is this contraception, is it really preventing fertilization? Or is it destroying an embryo? And I think that's what you have to look at.
Yeah, talk to us about that, because I don't think that people really understand what's happening there.
So, and I've researched this a lot because I had to decide what I felt was in my conscience right to do. So a regular birth control pill with estrogen and progesterone, I would say that that basically works to prevent ovulation. So the woman doesn't release an egg. So I don't consider the combination birth control pill an abortifacient. Now, some people would say, well, in rare cases that could happen. And, it's difficult to get to understand, every possibility. But in general, that pill works by the woman not releasing an egg. Now, the progesterone only pill sometimes prevents ovulation, sometimes thickens the cervical mucus so the sperm can't get through. That's fine. But sometimes it prevents the implantation of the embryo. So I would put that in a different category.
So would you see that as a potentially an abortion inducing result? Because from what I understand, this is like the lay version of this, but so please forgive me for how crude this might be. But when the egg is traveling, it can get fertilized, but it still takes a few days for it to actually arrive at its destination and be implanted in the uterus. And so if we're saying, as we said earlier, that when the egg and the sperm meet, that zygote has its own unique DNA. So if it takes a few days to get implanted, and then what happens with some kinds of hormonal birth control, what it does is it creates like a hostile environment in the uterus so that the zygote cannot implant. And so if we're saying in principle, life begins at fertilization, then that life would then be expelled. Am I on the right track there with that?
Exactly. I couldn't have said it any better. That was
Girl, look at you with your scientific knowledge.
Well, I told you I took a medical ethics class in seminary.
Dr. Bontrager.
Yeah.
Yes, I didn't know I was sitting next to someone with so much knowledge and wisdom.
Well, I told you I had to take this medical ethics class in seminary, and for some reason it really stuck with me. But this is one of those issues. So now, which is it again? Which is the type of hormonal birth control that could result in that?
The hostile environment?
Yeah.
Well, I've only talked about two.
Okay.
But I talked about the two different kinds of pills. So there's the most common pill that most people take would be, the regular birth control pill that has both hormones, estrogen and progesterone. Okay. The other, women are maybe given if they're breastfeeding or have some medical conditions. I personally, when I look at the mechanism of that, I'm not comfortable prescribing that. That's how I would say it. Now, there's other progesterone only methods like the Depo-Provera shot that for the most part prevents ovulation. And so, that to me, that's a very good option as well.
Now, what about the IUD? That's one what's the mechanism that works on? And do you have concerns about that one?
So there are two kinds of IUDs, two classes. One is progesterone IUD, and one is a copper IUD. Well, the copper IUD clearly doesn't allow the embryo to implant. The progesterone IUD, there's probably different mechanisms it works by, and may often prevent ovulation. But I think some of these mechanisms are unclear, and there's people doing these studies to measure hormone levels and all that. I don't prescribe IUDs because I can't be sure how they work.
So if I'm going to my gynecologist and I am asking about hormonal birth control, and I believe that life begins at fertilization, the question I want to ask my doctor, it sounds like, is I would like a birth control method that prevents ovulation. Is that the question I want to ask?
That would, yes.
Okay.
I think that's a good way to put it. Primarily, that's its main mechanism. Yes.
Okay.
And I have had patients who are very pro-life, and I love these discussions because they bring those things up, and then I can have these kind of conversations with them. But most patients don't ask those questions, but yes.
So in saying that, I want this type of birth control, how do we know if the doctor isn't prescribing me, the other kind? Is there something that I can look for, or words that I should know, or is it kind of just like a trust factor?
Like when you're reading the packaging?
I don't know if there's words. I can't take birth control. It gives me severe leg cramps. Don't take birth control if you get leg cramps. But see, I know scientific things. She'll tell you. She will tell you, I guess she might. Yeah. But I was always told don't take birth control if you get leg cramps. Anyway, That's a whole nother story. I'm just wondering, if I go into my doctor and I'm like, okay, I want this type of birth control, would they, what if they just give me the other kind?
How would you know?
How would I know?
You'd have to read the packaging about how it works.
Well, what kind of wording would I look for? Chris seems very concerned about me. I'm sorry. This is just me.
So I think that goes back to, you need to be going to a doctor that you trust and that you can have these kind of conversations with. And I think I would explain, hey, these are my views, and I am not comfortable with any kind of contraception unless XYZ, and explain that. And, or if you can find a pro-life doctor, that's great. And they may understand that better. But I think it's having that conversation, again, the doctor may have different views, but they need to respect your views. And, maybe, and discuss what the options are for you.
Now we're getting some questions here about Norplant. I don't know what Norplant is, but it's another, I think, implant type of birth control. And how does that work? Is that anything you know anything about?
Yeah, Norplant. That's like a blast from my past. It's these rods in the arm. It's very uncommon. It's progesterone producing. I say a blast from my past because this reminds me of residency when the Norplant was more common. Norplant, people that use Norplant, and actually not a lot of women like it. And there's a newer form of Norplant. It's called called Norplant. But again, these it probably most of the time prevents ovulation, but not all of the time.
Okay.
Now there's someone on our Facebook page, on the Center for Biblical Unity Facebook page, Beck Andrew, and they say, Please tell Chris she is nailing it with an exclamation point. You are all doing a fantastic job covering this scientifically, carefully, and biblically.
Well, thank you.
So
Thank you, Beck.
We're trying. Now, there was one more question I wanted to go to here. What do you do when you're dealing with a patient who really wants an abortion? Maybe that's their perspective, their worldview. How do you handle that? Like, do you just, because you're a pro-life OB, do you just refer them to another doctor and then they can get services from somebody else? How do you handle that kind of ethical situation?
Right. And that can be difficult because, again, I need to respect my patient's autonomy, but I also will not do something that violates my conscience. So again, you want to have the discussion and understand where they're coming from. Sometimes they have misperceptions, but let's say they, you've had these discussions and that's what they want. Well, then, I don't refer for abortions. I live in a place where they're not hard to get, I would say. I think it might be a doctor's obligation, if it were otherwise, to make sure how do I say this? You want her to go to somebody that will take care of her, so it's all about taking care of the patient. So.
Do that at the end. Okay. Kind of one final big topic I want us to cover, and that's chemical abortions, which is a kind of a new thing that's out there. I saw a TikTok video, and I'm not going to play it because it was too vile and wicked. But there was a TikTok video that I saw a couple weeks ago where a woman was protesting about Roe, and she took a chemical abortion pill right there during the protest and was like, see, I just aborted my baby right now. No big deal. And so maybe talk to us about chemical abortions. What is that? Because that might be new for people. And this technology and how chemical abortions work.
Sorry, I was muted. Chemical abortions, they are more in the news and they're becoming more common, but they're not actually new. They were approved in the United States in 2000. So you think of a surgical abortion is basically in the first trimester is a D&C procedure. A chemical abortion is taking pills to cause the abortion. So it can be called a chemical abortion, a medical abortion, a medication abortion, abortion pills. Now people think this is more safe than, or may think that it's more safe than surgical abortion. Hey, avoid a surgery if you can, right? But actually it's been shown to not be as safe. It's much more dangerous than a surgical abortion. Higher rates of hemorrhage. A study one study showed almost 4 times the risk of complications from a medication abortion.
So what would be, I have so many questions now, like what would be the difference between a chemical abortion and what we hear about like the morning after pill?
Mm-hmm.
That's a great question. So let me just go back to chemical abortion for a moment. So that's taking 2 medications. A woman in the first trimester, the first pill, mifepristone, is an anti-progesterone, and that basically the baby needs progesterone to live. So the anti-progesterone kills the baby. And then the second pill taken 1 to 2 days later, misoprostol, causes contractions. Basically the woman, goes into labor typically at home. So that is a chemical or medication abortion. So when you talk about, you asked about the morning after pill. So if a woman has unprotected sex and is concerned about getting pregnant, there are several different kinds of quote unquote morning after pills, supposedly to prevent pregnancy from happening. And depending on where and sometimes they do, but sometimes they also cause the embryo, not to implant, or they kill the embryo.
What is the time difference between like the morning after pill and a chemical abortion? Like, can you do like a chemical abortion at like 6 weeks, or would that be too long? Because the morning after pill, I'm assuming, is only good the morning after, but I don't know.
Well, that would be a good assumption. The morning after pill, typically it's would be people take it in three days, within 3 days, sometimes within 5 days, depending on the type of medicine used. But the sooner you take it after unprotected intercourse, the more effective it is in causing that woman not to continue or get pregnant. And the if you think about chemical abortion, which I think you were asking about, so a woman doesn't usually know she's pregnant until she misses a period, right? So by then she's, well, actually, she's 6 weeks from, or I'm sorry, she's 2 weeks from conception, but she wouldn't know till then that she's, so we're talking later in the pregnancy, I guess is what I'm talking. Still early, but now medication abortion in the United States is approved up to 10 weeks.
Wow.
Is that something that is a prescription that you have to get from the doctor? I'm not going to Walgreens to get a chemical abortion pill.
Oh, well, you can actually just get it online now. So you don't even have to go to Walgreens.
Wow. Like on Amazon?
So, I bring this up because when medication abortion was approved in 2000, it had certain regulations. It had to be prescribed by a doctor. It had to have certain office visits. Certain dispensed in a certain healthcare facility. The woman had to have 3 office visits. The doctor had to report any adverse events. In 2016, no longer has to be a doctor. They increased the gestational age. Only 1 office visit required. And then in 2021, it no longer has to even be dispensed in a healthcare facility.
Yeah, Monique she found it on Amazon.
That's deep.
Right. So I'm not saying that's legal, but what's happening is the FDA has removed restrictions, and there is a big push to make this just, do it yourself. And it's really inappropriate. Again, I have 2 patients, but if you're going to do an abortion, please take care of the mother at least, I hate to say it that way, but what's happening is these things are, now any medication has risks and side effects, but, this has been pushed to where it's unsupervised. There will be no physician. They often don't do ultrasound. So then the woman might have an ectopic pregnancy. She might be farther along. There can be a lot of complications by this self-managed abortion.
Wow. And
it's getting pushed more and more because I think that, with the states that might, outlaw abortion, then the push is that, well, you can get it other ways through the mail, pick it up in another state, all kinds of things. Well, it's very convenient, but it's not appropriate.
I have so many questions now because, all right, I thought I heard you say that you could get a chemical abortion up to 10 weeks, but that seems to me that the baby would be like, when I was pregnant with Emily, it was when she was about 10 weeks along, and we had the ultrasound shortly after that, the first ultrasound. I just have so many questions. Like, how would you do that at home? That seems very risky.
Well, that's it's very insightful. It's true. And just think about this, you take this pill to kill your baby. You take this pill to then, basically puts you into labor.
Yeah.
And women are told, oh, this is safe and easy. If you go look this up online, safe and easy, safer than Tylenol is out there. It is not safer than Tylenol. Okay. Even if you think abortion is ethically okay, this is not the way to do it.
Is this kind of the new back alley abortion?
I wouldn't call it that because it's physicians who are pushing it. It's Planned Parenthood. It's the pro-abortion It's American College of OB-GYN. It's the pro-choice physician, pro-abortion physicians.
But it's really trying to mainstream it, normalize it to the point that, like,
Yes,
I'm potentially buying shady stuff on Amazon.
No, that's shady for real. They got a drink you can drink after you take your morning after pill, because apparently there's some side effects, and this will help you to bounce back.
Now you're looking at morning after pill. The morning after pill would be what we talked about, the emergency contraception. Yeah. That's not the chemical abortion.
Okay.
Yes, that is different. But I mean, even this runs the because I typed in chemical abortion first, but then I went back and I did morning after pill. And the morning, I mean, it runs the spectrum. You can get one for $9.99 or you can spend $60. How do I know which one will be better? Mm-hmm. I mean, is there a knockoff brand?
Well, here's the problem. So many problems. First of all, what's in those pills? But even if you do it, say you do it legally, I can't imagine that's legal. You still, there's no require, it's the prescriber's not required to be a physician. They often don't get an ultrasound. And they don't even have to see the woman before the abortion. So I think what we're going to see is a lot more complications from medication abortion. And then I think that people are going to say, see, you overturned Roe v. Wade, and now we have this happening. Well, that's not why it's happening. It's happening because you're pushing the unsafe, pushing the limits of something that, has risks. And then when you push it beyond that, it has higher risks. Women are going to suffer, unfortunately.
I don't even know what to say. I don't. I
mean, we could do an hour discussion just on medication abortion, really.
She said you can buy boric acid for your vagina on Amazon.
It's a suppository applicator.
You guys always go shopping on your show.
No, we don't. But I mean, you're breaking it down. I feel like I need to research this. I didn't know it was a thing. It's so scary to think that that this is being allowed and being encouraged to be on a site like Amazon, where a kid who, has their parents' credit card or something could possibly go and just order this without their parents' knowledge. Oh. Like, what would stop a 14-year-old from logging on to Amazon and priming it to her house or to her friend's house?
Right. So I haven't looked on Amazon, but I have done some research on how you get the abortion pill, medication abortion online. And there is a site, there's many sites, but it basically, you put in your state and it will tell you, yeah, well, you live in a restricted state, so you can do this. You can get it this way from, other websites, and they, will ask you some medical questions. But it's so inappropriate. This is not taking care of women. This is not, on so many levels, not taking care of women.
Okay. All right. Get off that side.
Yeah, let's click tragic. Off of that. All right. So someone's asking, is taking these kinds of pills, does it compromise the uterus? Like, could there be long-term damage to taking some of these, the morning after pill or a chemical abortion
or
pill?
Even long-term contraceptive use? Yeah. I don't know.
Well, there are some long-term effects of abortion. Like, we know that preterm birth is increased in women who've had abortions and increasing with the number of abortions. Now, I will say that most of that data is from surgical abortions, which kind of makes sense. I don't know that we have as much data on medication abortion. It's interesting that women, the narrative out there is also that abortion is safer than childbirth, but actually the truth is that women are much more likely to die within 180 days of an abortion than of having a child.
Wow. It's so sad. So, all right, we're going to do one last question here that's coming in on the live stream
on the YouTube page.
On YouTube, Zoe Abundant. I have seen people saying late term, more specifically full term abortions aren't legal and don't happen. What is the truth? Is that
so? The question is about late term abortions.
Yeah. Is that real? Do they really happen? Or is that just...
Well, it depends what you call late term. I mean, there are certainly abortions happening at a point where the baby can live outside the womb. I think they're talking about what's called a DNX procedure, or partial birth abortion that's been outlawed. So that's where I won't even go into the details because that will really make you upset.
It's disturbing. Yeah.
Very disturbing. But yeah, there are third trimester abortions depending on your state. Third trimester abortions. I mean, you heard about that situation in DC where they found these babies. They were full term or close to term. It's horrific.
Because by the third trimester, a baby could, in most cases, live outside the womb.
Yes. Remember, at 22 weeks, 24 weeks, babies are living outside the womb.
Yeah, that's crazy. Well, thank you, Chris. This has been helpful and interesting. And thank you for fielding all of our questions and just giving us your perspective as a Christian working in this field. Just thank you so much for all that you do and standing for life in your practice. And hopefully this will be an inspiration to others.
Yeah, I think it's an inspiration to me. I mean, I've learned a lot, and I feel like I even have more words for people that I know that are, standing for choice or abortion and things like that. So thank you very much just for sharing and just being real and honest and not holding back.
Yeah.
Well, thank you so much. This has been so wonderful. I really appreciate this opportunity, and you guys are great. So thank you to everyone who's on the call.
Oh, thank you so much.
Thank you.
All right. Good night. God bless.
Good night. God bless.
God bless you.
Wow. Okay. So what are some takeaways you're getting from that conversation?
I didn't know that neonatal hospice was a thing.
Yeah.
I like the language of having to separate the mother and the child. And it sounds like, that there's just so much dignity that can be offered to a baby, if they are, going to pass away.
Yeah.
I love the fact that
we don't there's a difference between passively passing away and actively killing.
Yes.
That's an important distinction.
I love the fact of just how gentle she is in her answers, and yet hardcore. Like we're not wishy-washy on the fact that this is life and we're talking about life, and yet her answer is it's just fact. It's just here. It's just truth.
Yeah.
So I don't know. I just really appreciate
Chris has a very gentle demeanor. Yeah.
But hardcore. Like I love
she's
that.
She's clear about where she stands.
I absolutely love that.
Yeah. I think for me, just learning a little bit more about chemical abortions, that's and just the scenario that you proposed of, teenage girls going on the Amazon and ordering shady things and having it sent to their house, and just how scary that would be.
And even, to me, making that available just so willy-nilly, like just so anybody on Amazon can get it, that is not a stand for life. No. That's not a stand for the dignity of a person, because kids, especially when they, find themselves in jams and situations and, they're panicking and all of that, they're going to potentially not make the best choices. Yeah. I don't always make the best choices, and I'm a full grown adult. You know what I mean? So we need to also remember that we have kids to raise and to protect. And when people are advocating for, having Amazon sell the morning after pill or boric acid suppositories,
I don't even want to know what that is. Tiana says parents need to keep open lines of communication with their kids and provide a safe adult. I agree. The only thing I would add to that, Tiana, is that we need to make sure that our adults are informed so that they can speak into those kids' lives in a way that is biblically consistent.
Yes.
Standing for the life of the baby. But yeah, this is eye-opening stuff. Okay, we're gonna hear from our friends at Impact 360, and then we're gonna come back with a tweet of the week. So don't go anywhere. We'll be back in 1 minute.
Change isn't going to come just because you want it to. Change comes because you are intentionally taking steps to making that change.
I aspire to be someone who continues to build bridges with other cultures and who cultivates a community that's healthy and honoring to the Lord and life-giving.
Now, after the program, I feel like I know what my purpose is and I know what I want to do going out into the world. And had I not had this time to step back and just kind of be patient and be still and just listen, I don't think I would have had that same clarity.
In this world, it's kind of like in a scream contest. Who can scream the loudest and who's going to listen to that person yelling the loudest? And that person should be God, but he's not yelling, he's calling us. My hope going forward to interact with culture is to tell people like, hey, like be still, listen to this guy, he's calling you home.
Okay, we're back. Wow, guys, we hope you found the interview with Dr. Cirucci.
Yes, Chris.
Helpful. Let us know in the chat what you enjoyed about it, what your takeaways were.
Yeah.
All right.
I was also going to say, make sure to share this with your friends. If you have a friend who might have a teenager, son or daughter, make sure that you're sharing this information, or, maybe it's your pro-choice friend or your pastor who doesn't know how to necessarily address these issues. Get it out there. And this is like the content is being created so that people can share it and be empowered.
Yeah. All right. Now it's time for the tweet of the week.
The tweet of the week.
Okay, we haven't done this in a while, but we do have a tweet this week. Big news hitting this week about Emmett Till in the news, and we wanted to make sure to cover it. We didn't have time to do it on the family meeting. So this is from an account that we follow called African and Black History, but it's been all over the AP and the news.
Huffington Post.
Yeah, it's been everywhere. That there were a team of people that were doing some digging in a basement in a courthouse in Mississippi and found the original arrest warrant for Carolyn Bryant Donham, who accused 14-year-old Emmett Till. This was back in the 50s. And they found the arrest warrant for her. She, however, was never arrested. Now, Emmett Till, you can see a little picture of him there on the left. He was a young teenage
14
Black young person. On the right there was the woman, and there's a more recent picture of her. Now, for those who are watching, and Emmett Till is a news story, maybe they're not familiar with who he is, or they've only heard his name. Tell us about him.
So Emmett Till was a 14-year-old boy. He was a Black child, and he went down to visit his family in Mississippi. He was originally from Chicago. Went down to spend some time with his family down there. And while down there, it is reported that he whistled at a white woman.
And his cousins were there and testified that he did whistle at her.
Yes. And how much
she was a
persuasion went into that testimony, yeah. I'm not sure. I wonder if people will say that they, testified that he whistled under persuasion.
Oh, okay.
I don't know.
Coercion.
Yeah, coercion. So with that, the woman then told her husband and made it bigger than even just a whistle, that he touched her, he roughed her up, that there was some physical contact in there.
Now he was 14.
He was 14. I believe
Okay.
she was 20 or 21.
Okay. And she was working in the store, I think, as a clerk. Yeah.
And I think he was either like down a little ways from her or across the street. But this interaction ensued in the middle of the night that night, or might have even been like the next night. The Karen Dorham, I believe is her last name. Well, her husband and I believe it's like his brother and some friends went and got Emmett Till from his family's home.
So they kidnapped him.
They kidnapped him, beat him, and just horrible things. And ended up shooting him and then tying, it was a fan around his some part of his body.
Cotton gin.
Oh, I thought it was a fan, like the motor part of.
What I read on the AP was that they tied a cotton gin around his neck. So I'm going by the AP.
Okay.
If that's
either
wrong,
way,
yeah.
they tied
something,
some huge piece of equipment to him and threw him to the bottom of the lake.
Yeah.
His body was retrieved. He was basically unrecognizable. And his mother at the funeral actually had an open casket funeral to be able to show the world what basically racism and evil did to her child. And so this story has gone on, and the men, I don't believe they ever did time. I'm not sure that they were actually like put on trial. I'm not sure, but
his mother, Emmett Till's mother, kept asking for justice persistently over the years. She made that decision to have an open casket. Now, if people want to go look at the picture on Twitter, it's there of the open casket. We're not going to show it because it's fairly graphic. But that decision to have an open casket
was very
intentional. It was very intentional. And from what you told me the other day, that Emmett Till's death really changed the conversation about civil rights.
I believe it was one of the foremost conversations about changing civil rights. It took another 10 years or so before it actually happened. But I think Emmett Till's death and the bombing of the 4 girls at the Birmingham church, I think that
those are kind of markers, like beginning and end. Like Emmett Till's death happened sort of at the genesis of the civil rights movement. The bombing at the 16th Street Baptist Church in Birmingham that you and I went to several months ago, that really pushed
things over the edge.
Yeah, that it pushed civil rights into, pressuring, like, let's get it passed into law.
Yeah, because now these are children. It's not like adults are, having their qualms. It's children.
So what are your thoughts about this whole idea about pushing to arrest this woman who's now in her 80s?
Here's the thing, is that a couple of years back, she actually confessed that she lied.
Oh.
Yes. And I'm not sure if there was a jurisdiction time or something like that, but it came out.
Statute of limitations.
Yeah, statute of limitations. But it actually came out that she lied and didn't tell the truth about what happened. Oh, sorry, I have hair in my mouth. So what? I had hair in my mouth. I can't talk with hair in my mouth.
Must you pronounce that? All right, go ahead.
I just want people to see me just digging in my lip and
I was
not know what was going on.
Press the mute button. All right, go ahead.
So fast forward, and now people are digging around in the basement of, I don't know if it was an old courthouse, but they found the original arrest warrant, which could potentially mean new evidence is being brought in.
Because Emmett Till still has relatives, cousins specifically, who are alive and still trying to fight for justice on his behalf.
Yes. So the conversation is it right to arrest this woman?
She's in her 80s.
She's in her 80s.
So some people would say she wasn't arrested, apparently, back in the 50s because when the sheriffs got the arrest warrant, they're like, she has 2 young kids. We don't want to arrest her. Well, now the story is we don't want to arrest her. She's an old woman. Some people are making that argument. I'm just curious what your thoughts are about it at this point, based on what which, but just what are your thoughts? Do you
arrest her?
So you're pro the arrest?
Yes, I am completely womb to tomb. And so if you do something that our judicial system says, you are responsible, it's biblical. If I kill someone, and I'm not saying that she killed him, but if I am responsible for the death of someone, and that now means my death, that is one, that's a biblical precedent. Like, I'm not just trying to look at it from the issue of like the laws of the land, but also biblically, what does justice say? How do we mete out justice? There's no age limit on justice. Like that isn't a biblical concept from my understanding. Now, could I be wrong? Could somebody send me over a scripture and say, hey, look, the law says, we don't, do these things over anybody who's 79. I haven't seen that. Biblically, justice would say, you did this, you are responsible for this, and this is the consequence of that. How do we mete out justice? And so I think for people who are saying, well, she's really old now and all that, it doesn't fall, on my heart as being an issue that I have to be concerned about. The issue that I need to be concerned about is what is the biblical mandate or requirement for justice to be served.
Yeah. Thank you, Natalie, for encouraging people to hit that like button. AJ says that the murderers went on trial, but they were acquitted. After that, they did a magazine confession because they couldn't be prosecuted
Double
again.
Jeopardy.
Oh, interesting.
But I don't think she ever confessed. What I remember is like sometime within the last 10 years, I'll say that, she actually came out and said that she had lied about it all. But I would feel this way if it was black on white. I would feel this way if it was black on black, white on white, because to me, there's a biblical standard for justice, and there's a biblical standard for how we treat human persons. You don't kill a human person, just like we don't murder. And so that's the standard. And when we do murder, there are repercussions for when you murder or when you assist in a murder. And when you get found out that you assisted or that you murdered, justice needs to be meted out.
Yeah, I think my only question, and there's just so many things I don't know, is, I don't know what the statute of limitations is on or what the specific charge would be, if that's accessory to murder or how that works. I don't know anything about that. But I mean, I understand the principle of what you're saying is just because somebody's old doesn't mean that they shouldn't be prosecuted.
That's not even on the table.
In fact, recently I saw something where there was like a 101-year-old Nazi guard who they finally found, arrested, and put on trial. He's 101.
That's
so
unfortunate.
At that level of accountability. Now, to me, there's just a lot of things that I don't know about how statute of limitations works on a charge like that, but it certainly does seem to be a miscarriage of justice that they had the arrest warrant and they just round filed it. Like, that's not right. So
I think somebody actually probably just hit it and put it way down deep where nobody thought that they would look.
Yeah.
But the argument of, we can't do anything because she's too old. No. You can't argue and say that you are pro-life if you're not going to be for all of life. You know what I mean? And understand that sometimes being pro-life actually means that this person here faces the repercussions of their sin.
Yeah, I think the AJ says there's no statute of limitations on murder, which is correct. Yeah, there isn't. I just don't know what the charge was against her. I doubt it was murder. It was probably like accessory or something. I don't know what the statute of limitations on that would be. But anyways, well, those are some things to think about and some thoughts on that issue. We hope that you found this show helpful tonight. Please be sure to hit that like button. That really helps the algorithm in pushing it out to more people so that they will see it. And share the show and let us know what you thought and what other aspects of the abortion/pro-life conversation you would like us to cover in the coming weeks. We have some ideas.
Next week, we're going to be having a conversation with Katie Faust.
Yep.
Yeah. She has a book written called Us Before Them.
No,
Or, I'm sorry, Them Before Us. Talking about kids before adults. Yes.
So we're going to be talking about that and getting a little bit into the in vitro fertilization conversation, surrogacy, and all of that.
Looking
So
at the rights of children.
yeah.
Yeah.
So we will see you next week. Take care and God bless.
God bless.
There's nothing left.